you find the connective tissue, which it has a depression. From there you go laterally and you will find the inguinal ligament, which the lateral landmark is the anterior superior iliac spine, which you can find it here. So pubic symphysis, 1 inch lateral.
There is iliac crest.
Now, before iliac crest, after the skin, on the lower abdomen, what can you find? In the lower abdomen, what kind of fascia can you find? No, the name of it is scapa. The name changed. It's a fascia, superficial fascia. We don't have it on the lower abdomen. So the name changes to scapa. Below the scapa, there is a very good landmark, which I'm very sure you have known it from the other cadaver. What is this? Holding line. Okay, now please touch the holding line. Show me the holding line. You have to go to that side because you have to go medial. Hemen, hold it. The scapa is a superficial layer. So it should be the first layer after skin. First layer after skin. Yes, one hand, because if it is in human, one hand like this. Just one hand like this, one finger.
One hand.
Don't mind me, one finger. She was literally following my English. Don't mind my English, don't listen to me. Oh?
Where is rectus abdominis? Zarka.
First, you tell us the landmark. Because if I ask you, how do you know it's the rectus abdominis?
Because it's above the umbilicus.
What up below the umbilicus? What is this then?
Pyramidalis?
No, it is the rectus abdominis. Rectus abdominis starts from the costal margin on to the below the inguinal, right? The inferior border of the abdomen.
Yesterday the professor said that the third...
Have you heard about the six packs?
Six packs.
Six packs.
It's all covered by the rectus abdominis. So
Rectus
it's the
abdominis.
superficial.
But he said that...
pyramidal.
No.
Okay,
He
what
said
do we
that
have
the-
between the rectus abdominis?
The intertendinous things.
No, interconnection, yeah.
Intratendimus.
You can.
But it's the same
first
also, the
layer here,
interconnect-
the
intersection
superficial
tendon.
Ammar, please show me the iliac
is the
crest.
rectus abdominis.
What?
You can
Show me
find
the
even
iliac
the
crest.
pyramidal on the
Iliac crest,
had
you mean
it.
this one?
This one,
No,
he
this is
doesn't
not
have
the iliac
any
crest.
pyramidal. It's a variation on some people. Some people have pyramidal. As yesterday he said, some percentage of people have pyramidal.
10%.
Some
Should be
doesn't have
right there.
10%,
This one, right?
10%.
10%.
Yes.
So that's it.
We'll be doctors. We'll be doctors. So don't get afraid of touching or examining anything. Show me the iliac crest.
This one?
No.
This one inguinal.
No.
No.
Maaf.
Not the iliac crest.
I don't know.
Show me the abdominal margin. The costal margin. Exactly. Where's the iliac crest? If you have to move things, move. But show me the iliac crest.
This is ASI.
This is the iliac crest.
You don't request this one?
No. This is the spine.
This is the ASIS.
Anterior
right?
superior iliac spine.
Right?
Then
When we
below
say
it, the
Yeah, this one.
inguinal ligament
When
is
saying
lying on the crest.
is this. This is the iliac crest.
No,
it's
the
fine.
inguinal ligament is lying on the crest.
Yeah,
This is
that's
the
what.
crest.
This is the...
Yeah, so it was right.
But where is the highest point in the
Yeah.
crest?
Yeah, the highest point, the lateral lip.
Where's the xiphoid? Xiphoid bone. Yeah, move now.
Amma, this is the xiphoid.
It's not here.
No, this
What's
one?
the pointy
The tip is
bone? The tip of the bone.
You mean
That's
this
your
one?
landmark.
This is the land. Exactly what's that. Really early.
Let's see how can we any good. Alanta Mumshon.
Will you
Can you show me the superior
Do you have
iliac
muscles
spine?
here? Do you have muscles
Do you
here?
have
This-
even answered? Yeah. You have the rectus abdominal.
Please show me the external
External and internal
oblique.
External oblique, it should be
Where is
this
the
one?
external oblique?
First, you have to tell me why it's intact. Why do you find it?
Where is
No,
the
this one,
external
this-
oblique?
How can you find
This
it?
one?
No, this is the rectus abdominis.
Exactly.
Okay, you know what? It's not your fault. Inna lillahi.
No, don't use phone.
Don't remove it.
Yeah.
Oh my God.
What did you do?
I didn't do it.
It's alright.
This is the, laterally you can only find the external. internal and transverse abdominis fascia.
You mean this is aponeurosis?
This is anterior, right? You cannot find it.
Here,
You
around
should
here.
find it at the lateral side. And here it is. Exactly what makes the rectus sheet. The aponeurosis of these three muscles make the rectus sheet. That
So-
is coming to the midline. So it
It's
covers
actually two, internal oblique muscle and the transverse.
This is the external oblique muscle. It goes medially downward. This is the internal, right? It goes laterally upward. And what can we find behind it? The transverse abdominis fascia.
We should
But because
be
this
down.
one there is deformity, or let's say some mistake they make, so they just mix the transverse abdominis fascia and the internal oblique muscle, so you cannot differentiate the two. So if they just ask you where is the internal and the transverse, you just show this. As you can see, the fascia fibers is here, and also the muscle is here, right? And that's all. So this is what peritoneum.
Where?
If we go, this one's supposed to cover the whole stomach.
You mean the downside, the most deepest one is the perineum.
No, this is the fascia is here.
Facial is not down. These are muscle fibers.
Said is your number what? I told you they had mistake here, moving it. They had a mistake here.
And where the finger he mentioned in the lecture? The finger of the muscle?
It's supposed to be the internal oblique muscle. Then they should remove the fascia. But because of the problem they had, they couldn't remove the fascia. So you can see some of the fascia are here, some of the fascia is here. And some of the internal oblique muscle is still here. Can you see? It's still here. So it's supposed to be all like this, removed. But they left it. So now it's muscle and fiber and fascia together. So after the transverse abdominis fascia, what can you see? Peritoneum.
Oh, right.
Yeah. So peritoneum consists of what? What does it consist of? Cell, matrix, fibers, and mesothelial cell. So obviously, if this is not there, you can see the fibers obviously.
Is the transverse fascia present around the lower part of the abdomen, or is it just on the lateral
I
side?
think it's on the only the lateral side. Then the peritoneum covers the anterior also.
It is connected. But
Connected.
interiorly it is going to change into fascia
It will
lata.
change to fascia lata,
Fascia lata.
and also here it will change to scapa. It's the same thing, but when it comes
But
anteriorly,
like scarpa is the superficial fascia.
Yeah.
And transverse fascia is a different situation.
no,
Scarpa is the membrane of the superficial fascia. It is starting from the just below the
the
umbilicus.
umbilicus.
So we don't have scarpa above the.
Yeah.
So that's it.
You mean this is-
Superficial membrane.
So-
Galaxy membrane below.
मुझे पता है लेकिन scarpa
This
और
one?
transverse fascia एक चीज नहीं है.
नहीं है।
Good form.
गलती से कर।
So you said that scarpa is this one, right? Because it's
No, it is
below the
not.
umbilical.
This is only scapa. This is dissection room. You don't imagine this.
Scarpa starts from here.
Start from there, but
Yeah.
it's not below the umbilical.
Few
Definitely.
inches below the umbilicus.
Few inches below
This is the
umbilical.
rectus sheet covering the rectus abdominis muscle.
Rectus is covering the rectus abdomen. Okay, see.
You should not accept anything other than rectus sheet and rectus abdominis, because if the muscles are here laterally, then their aponeurosis are coming like this, right? And they make the sheet which covers the rectus abdominis, and the only muscle we can find anteriorly, most superficial muscle, is the rectus abdominis. So you should not expect scarpa here. Scarpa you should expect it from where this lateral inferiorly, right?
Yeah.
They have removed here, so you don't imagine it.
So where is the camper is above them, which means it should be. Where is the camper? And the camper fascia.
No camper in this cadaver.
I see.
I think you can find it in the first cadaver.
Okay.
It's not here.